in a province of nearly 15 million people, we have a total of 48 people in hospital. This is a hospital system that has 32,000 beds capacity in it. And we stated clearly at the beginning we didn't want to overwhelm the healthcare system. Well, by any measure, 48 individuals in hospitals with 32,000 bed capacity, even for the most incompetent bureaucrats, cannot be considered overwhelming, right? And the same, they fail to report that there's zero deaths in many days.
I'm Tamara Ugolini with Rebel News here in Perth, Ontario, with local MPP Randy Hillier. Now, Randy has been a continued dissenting voice of rational and reasoning throughout the COVID-19 pandemic. And Randy, correct me if I'm wrong, but the advocacy toward government transparency with accurate stats, and specifically about the death and the hospitalization rates versus the continued sort of pushing of the case narrative, is something that you've been sort of focused on recently.
Well, I've been focused on the irrational and unreasonable behavior of government, especially in Ontario, but not just the provincial government. Our local health units as well. And the point about the cases is one of those aspects. When you look at it, without indicating the severity of the illness or severity of the virus, and you focus only on how many people test positive, you're giving people a false image, a false illustration of the virus. And as we can see in Ontario, every day they announce another 115 cases. What they're not telling you is the important. They're not telling you how many of those people required medical attention. And you need to sift through the data, and you have to peel back how they obscure this information to find out. And yesterday in Ontario, with 115 cases identified as positive, going through, you found out that there was 4 people required hospitalization. And then you have to peel back a little bit more, and you see, well, in a province of nearly 15 million people, we have a total of 48 people in hospital. This is a hospital system that has 32,000 beds capacity in it. And we stated clearly at the beginning we didn't want to overwhelm the healthcare system. Well, by any measure, 48 individuals in hospitals with 32,000 bed capacity, even for the most incompetent bureaucrats, cannot be considered overwhelming.
When you were kicked out of caucus, I think it was 2018. Now, I assume that you keep in touch with your former colleagues. And so can you provide any insight in terms of how they feel Doug Ford has handled the pandemic or any of the other things involved within the last 6-8 months?
Well, let me first off clarify. I was offered to go back. I was offered to go back into the Conservative caucus. I refused to accept the conditions of muzzling me, and therefore I'm not in caucus.
And 2 years ago, being muzzled.
It was bad enough 2 years ago. That muzzling is continuing today. We saw with Belinda Karahalios, the MPP for Cambridge, who was kicked out of caucus for representing her constituents. I can tell you, I'm not going to share confidentiality, but there are a number of Progressive Conservative caucus members who think and believe that what the Ford administration is doing is wrong. I speak with them frequently. I speak with them often. There's many of them phone me up and applaud me for speaking out, doing what they themselves would like to do, but are subject to that retribution and that coercive element of party politics.
Just sort of going back to Doug Ford, I mean, he seems to be cozying up quite closely to Chrystia Freeland and to the Toronto Star. Would you say that he's still this grassroots conservative that he campaigned to be?
Well, I would question if he ever was, from my, experience. I would question that assertion and the premise of your question.
Fair enough. Thank you. So as we see statistically, the pandemic's over. I mean, and there begs to reason whether or not it ever truly was the case-demic, perhaps, but the pandemic, it's over. However, we see increasing red tape for small businesses and continued measures and this idea that we're not going back to actual normal anytime soon. Do you think that that is a recipe for civil disobedience?
Well, listen, I've always believed in peaceful, nonviolent civil disobedience. I practice it every day. So does my family. We don't wear masks. We haven't, and we won't. We go into the stores, and some people might consider that nonviolent, peaceful civil disobedience.
So can you comment at all on what the reasoning or the justification is at this point to not be going back to actual normal, having that real-time data and being able to no longer rely on projections and modeling that have shown in real time to be highly inaccurate and inflated?
Well, listen, this is all governments have some natural tendencies and natural characteristics. And one of those is never to admit that you're wrong. And that's where we find ourselves here in Ontario with Doug Ford. Governments don't want to admit that they overreacted, overreached, and they don't want to admit it was their actions that generated and instilled the level of fear into people that are still, I can tell you unequivocally, with absolute certainty, there are people in my community who will probably never leave their homes again. They are so fearful of this, and it's what the government has done. I don't believe it was done intentionally, but I also don't believe they gave any thought or consideration into the consequences of their actions when they were generating such fear. These guys don't want to admit that they put our healthcare system into a hole, our economy in the toilet. They don't want to admit that the actions and policies in long-term care were contributing factors to accelerating the death of many elderly people.
What is it? I think 82% of deaths were in long-term care homes?
Yeah, I think it's 70 or 80%. It's these, and this is again, wherever we saw these lockdowns, we saw these outrageous percentages of deaths from long-term care. But also we should say, like, the elderly were always going to be, and residents in long-term care were always going to be at a greater risk.
Just to kind of switch a little bit to the conversation, if we look to Australia and see how people who are not abiding by these masking and distancing guidelines, they're being tackled by police. Yeah. Do you think that we're headed that way in Canada with our policing services, especially as people become or grow tiresome of these restrictions and impositions?
Well, I think we've always been just one step away. Going back to the government and digging the hole, what they're always trying to do is trying to appease the fearful mob that they've created. And without thinking, their actions actually, instead of appeasing the fear, instead of alleviating the fear, amplify the fear. And this is the mandatory masks are a good example of that. Here, we didn't have a case anywhere in my riding for over a month. We hadn't had a fatality in, I believe, 2 months. There was no evidence of COVID present in this area. And I'm talking a large geographical area.
Two health units, right?
2 health units, 400,000 people, a number of counties, in the city of Kingston. And it was only after an extended period of time of no evidence of COVID that the health units brought in the mandatory masks. And, what they did is they reinstilled that this was still a danger. Health units, local governments, the provincial government, the federal government are all, I hope, unwittingly and unknowingly doing the wrong things. It should be evident to them that you don't go out and amplify the fears, but a responsible and reasonable elected government would attempt to attenuate the fears and would attempt to convey a proper understanding of the risk, not this apocalypse, which we have.
How do we come back from this and quickly and effectively, while factoring in that people are terrified?
Well, listen, democracy is a two-way street, okay? People need to be involved. People need to speak out. People need to be engaged. And I would say, in addition to writing your elected members and phoning your elected members and speaking out, I would also say to them, cancel your subscription to the Toronto Star and the Globe and Mail. Cancel your subscriptions to those publications that are promoting the fear. No longer like or share their fearful stories. Every time you click on, a publication, it goes cha-ching, cha-ching. Stop clicking on these media outlets who are promoting this fear. And send elected members a good, strong message, either by the phone, by email. Unfollow them on Facebook. Unfollow them on Twitter. Start using every tool that you have at your disposal to tell government what you want. Because what we have is not going to end well for anybody the longer we stay on this path.
If you like this story and you'd like us to continue bringing you the other side, please share this video and like and subscribe.